YouTube, welcome to Dr. Vibes, a learning point. In this video, we will study about intussusception. Now, this is a given clinical scenario in front of you, where an anxious mother comes to the emergency and complains that her infant has been crying intermittently since today morning and passing reddish mucoid stool. The infant is grossly dehydrated. How will you know that the person is dehydrated? You will see sunken eyes, dry lips and tongue, and there is decreased urine output. And there is also a history of rotavirus vaccination 1 week before the given episode. Now, how will you approach this case? First, after looking at this scenario, I assume that this is a case of intussusception. The spelling of which is very important. Intussusception. Intus, I-N-T-U-S, suscept, S-U-S-C-E-P, and shun, T-I-O-N, intussusception. Now, what is intussusception? It is the telescoping of one bowel loop into abdomen. Now, intussusceptum is that loop which goes in, and intussuscepiens is the receiving loop. What are the chief complaints that the patient presenting with? Obviously, there is abdominal pain which is cramping in nature. The person will draw up the arms and legs and will cry. Second, there will be abdominal distension. Third, there is vomiting. Fourth, red currant jelly stool. And fifth, there is sausage-shaped palpable mass, which is also called as Sein des Hunts. There are two types of intussusception. One is the primary and the second one is the secondary. Now, the secondary is also the pathological lead point. Primary occurs in children and there is hypertrophy of the pairs patches. In case of secondary, there is polyp, tumor and lipoma. Now, how will you investigate that yes, this is a case of intussusception? One is clinical history, second is the X-ray, third, you do USG in case of children where you see target sign and pseudo kidney sign. You can also do barium enema, which will show you a coiled spring appearance. I will share the X-rays in this video only. Now, how will you manage a case of intussusception? Intussusception is an emergency, so resuscitation has to be initiated early. And the reduction of intussusception just after diagnosis is the treatment of choice. Next, you can do the non-operative reduction using hydrostatic force or contrast, and this is the procedure of choice. Surgery is also available in which you do resection and anastomosis. But what are the indications of surgery? 1. The patient should have features of perforation or strangulation. It should be a secondary intussusception and there should be... See, this is how a target looks like. Now, when you do the USG in the children, in the left hand side you can see the similar picture of a target. This is the picture of a pseudo kidney sign. Can you see in the left side there is a kidney shaped structure? And this is a coiled spring appearance. See, there is a spring like thing.